Tips from the ER. Cover your nose. Did you know that the nasal COVID swab is nearly 100% effective in detecting COVID? That's because those fuckers live up there. What do you people not understand? What's your thought process? Half protection is better than no protection? Cause you would be wrong, motherfucker. That's like a cop asking for a bulletproof vest, but only from the belly down. If I put the vest around my chest, my lungs can't expand it. It makes it hard for me to breathe. Just protect my belly. Sure, you won't die from getting shot in the stomach, but a bullet to the chest certainly can kill you. But hey, I get it. If you think being told to cover your nose somehow infringes on your rights as a human being, then fuck it. Take the mask off. It's your choice, and I'm pro-choice. But remember, this virus can easily infect and kill those around you even if you feel fine. So how about for once in your life, you think about someone other than yourself? Put the damn mask on. Tips from the ER. Q-tips. Warning, do not insert swab into ear canal. Entering the ear canal could cause injury. Wow, right on the box. Let's turn it around for a variety of uses. Around the eye, that cut on your finger, your disgusting toes, or your electronics. Nowhere on this box do you see your ear. That's because you shouldn't be sticking Q-tips into your ear to clean out earwax. You wouldn't stick a giant Q-tip up your butt to clean the poop off the inner linings of your colon. You'd wait for the poop to come out and wipe the surface. Much the same way you should be doing with your ear. I don't care how badly you want that eargasm. Stop masturbating inside your ear, you horny, lonely motherfuckers. Find someone to help you with an old-fashioned orgasm so you can stop sticking Q-tips into your ears. Tips from the ER. Code black. But Dr. Burke, what do you mean there's a live bomb inside that living man's chest? That's never happened in the history of hospital histories. Leave it to a medical TV show to put a bomb inside a person inside a hospital. If you hear code black, it means it's time to pick your motherfucking ass up and evacuate. There's a bomb in the building, and you don't want to be there when it goes kaboom. It's probably one of the worst things that could happen to a hospital, right next to being crushed by a once-in-a-lifetime pandemic while running out of masks, gowns, and beds to take care of patients. Even if you didn't know what it means, hearing code black can easily put someone on edge. If we're trying to use codes to prevent panic amongst patients, might I suggest we change bomb threat to code bubbles? There's a bomb, code bubbles. Tips from the ER. We don't know what's wrong. That's right, after all the poking, prodding, touching, and undressing, your scans, your blood work, and your labs came back, and we can finally tell you that we have not one motherfucking clue why you are in pain. You think you'd be happy to hear that nothing's wrong with you, but you motherfuckers hate that answer. You'd rather be told you were dying. At least that would justify why you stressed out, rushed to the ER, and spent 6 hours at the hospital. Instead, you got handed the biggest set of blue balls the ER has to offer. Sometimes all you needed was a day off, ibuprofen, rest, and a better diet. If something hurts to move, stop moving it. Hurts to move your arm? Stop fucking moving your arm. Learn some physical therapy. You'd be surprised how many people have no idea how to use their own bodies. Anyways, thanks for coming to see us. That'll be $2,000. Tips from the ER. Fake seizures. Ah, yes. Usually a patient's last-ditch effort to keep themselves in the ER. Likely because we just told them we are done with their treatment and now they get to go to jail. That's when they drop to the ground and flop like a fish. Get off the floor, Richard. The officers are waiting. But some of you won't even put in that effort. You'll just go limp. That's when we take your hand, put it over your head, and drop it. If it smacks you in the face, alright, we believe you. You're unconscious. But most of the time, your hand will magically fall to the side and avoid your face. That's when we know, you's a liar, motherfucker. With real seizures, you won't care what starts hitting you. To prevent injuries from real seizures in the ER, we have what's called seizure pads that we strap onto the side rails to keep you from breaking your face or bruising your shins. Every ER I've worked at, we can never find the seizure pads when we need them, so we end up wrapping the rails with blankets and taping it together. It's quite ghetto, but it gets the job done. Tips from the ER. Tachycardia. Tachycardia is just a fancy medical way to say your heart is beating way too fast. This could be because of stress, fear, anxiety, anger, one too many bumps of cocaine, or you're just really excited to see me. I love you too, motherfuckers, but we need your heart to calm the fuck down. It's working too hard. If not, you're gonna start feeling dizzy, shortness of breath, and or chest pains. All bad. The first thing we're gonna do is get an EKG to make sure you're not having a heart attack. A fast heart rate could also be early signs that your body is having a severe infection or that it's bleeding out somewhere. Either way, we gotta fix it, and the sooner the better. Because just like any other muscle in your body that works out for too long, your heart's gonna get tired. And what starts out as a really fast heart rate will slowly die down to 0. Beep. Tips from the ER. Boxer's fracture. There is a bone in your hand that consistently gets broken whenever you punch something hard enough. That's this little bone right here, right below your pinky knuckle, aka your 5th fucking metatarsal. It's called a boxer's fracture, most likely because you were boxing. We see this injury all the time, but it's rarely because you were punching another person. You were more likely punching a wall. Something made you so damn angry you decided to use your fist to try to break a wall, but that wall ended up breaking your fist. And now you're here, motherfuckers, in the ER, sitting with regrets, getting an x-ray to see just how bad it is. Luckily for you, we have a very specific splint to heal just this type of injury. It's called an ulnar gutter. We take your 2 fingers, move it down just like that, wrap it around in place so it looks like you're walking around with a cobra for a couple weeks. We then kindly ask you the next time you're having an episode of rage to slowly count to 10. And if you still feel the need to hit that wall, use your other hand. Tips from the ER. Restraints. We here in the ER are happy to help you stay in bed if you can't do it yourself. Whether you're aggressively drunk, methed out, or just plain annoying, we're gonna tie you down. I told you to stop walking up to the nursing station. We will come to you. Restraints are what we use when we've had it with your physical activity. We call our trusty security guards, everyone grabs a limb, and we strap you to the bed. Depending on how naughty you are, we can tie just your wrist or include your ankles. Kinky motherfuckers, aren't you? Try spitting on us and we're gonna take care of that too, by putting a spit bag over your head and hoping you don't throw up. Can't have you drowning in your own vomit. That'd be bad. I've had to tackle patients and I've had patients tackle me. You may get one good swing in, but after that, rest assured, we're gonna swarm you faster than a Best Buy on Black Friday. Tips from the ER. How much do you weigh? I know you're uncomfortable talking about your weight. You're still working on burning off that last layer of COVID fat you built up sitting on your couch eating Taco Bell during quarantine. But if you check into the ER, we will ask you for your weight. Sometimes we just need an estimate. Other times, we need it to be very accurate. For example, if you're having a stroke, we will need an accurate weight to get you the right amount of medication to save your life. If you can't speak or stand on a scale because you're currently stroking out, don't you worry, motherfuckers. The ER has beds with scales built into them, so all you have to do is lay there and stroke in peace. But mostly, we will just need an estimate. Just in case you start to act up, we know how much medication to tranquilize you with. Just kidding, motherfuckers. We don't need to wait for that. Everyone gets the maximum dose, because this is the ER, and we don't have time to fuck around. So if you'd be so kind, please tell us. How much do you weigh? Tips from the ER. HIPAA, or the Health Insurance Portability and Accountability Act, but nobody calls it that. Ask any healthcare worker, they'd be lucky to get 3 out of 5 of those words. HIPAA is the reason we can't tell anybody about your naughty healthcare business without your knowledge or consent. If you accidentally get a condom stuck in you cheating on your wife or husband, don't you worry, your secret's safe with us. We're not going to tell them anything without your permission because of HIPAA. We will talk about it in the break room though, but we won't post it on social media. If your loved one was in an accident and you call the ER to check up on them, we're not going to tell you a damn thing over the phone because we have no fucking clue if you are who you say you are. We might tell you whether or not they're dying, but besides that, our lips are sealed. Don't be mad at us. Be mad at HIPAA. It's a reason so many healthcare workers get fired. You really want to know the craziest thing I've ever seen in the ER? I can't tell you, motherfucker.